My name is Abbas Al-Kurd. I'm the first-year transplant surgery fellow at Henry Ford. When I was looking for a fellowship program, I was looking for a program that would provide quality training. I wanted to be sure that by the end of fellowship, I would be a competent transplant and hepatobiliary surgeon. When I interviewed at Henry Ford, I found that this would be the program that would provide such training for me. The attendings seemed to be extremely invested in fellow education. And as a fellow, I've come to realize that that is definitely true, and I have not been disappointed at all. Transplant surgery fellowship is by far one of the hardest fellowships out there. I think that we are the hardest working fellows in the hospital. That said, what's good about transplant surgery is that it comes in waves, or the busyness comes in waves. There's a lot of time when you're operating all night, when you're working, but there's also a lot of downtime, and I think this program is unique in that it's able to identify that and to allow the fellow to take that downtime when it's available. If I were to look back and to look at or to think about those the most memorable moments during my fellowship, something that pops out to me surgically, or technically at least, is that is the day I did my first deceased donor operation by myself, and brought back the liver to the hospital, watched that liver get reperfused, and then eventually watched the patient get better and go home. I think there are only a minority of transplant surgery fellowship programs in which the vast majority of liver transplants are done with one attending. Obviously, occasionally two attendings are required and are present from the beginning for complex cases, for redo cases, for cases where we anticipate difficulty, but that's okay. Patient safety comes before everything. But when the vast majority of cases are done with one attending, that gives the fellow an excellent opportunity to get some very good training. And obviously the fellow would be doing more in those cases than he or she would be doing in the presence of two attendings. You see your progression, your surgical technical progression on a daily basis, and that's just amazing to see.